Hello, my name is Dr. DrGlassber. Welcome to the Laser Skin Care Center. I'm one of the partners of the practice and a clinical assistant professor at the UCLA School of Medicine. I've been in practice 22 years, and my training was at Harbor UCLA for my residency, and I attended the USC School of Medicine prior to that. I also did a fellowship in Mohs micrographic surgery, skin cancer removal at UCLA as well. The Laser Skin Care Center was founded 18 years ago by myself and Dr. Brian Kane, as we were looking to initiate a practice that had a focus on both medical, surgical, and cosmetic dermatology, using the latest technology in laser medicine and techniques, including lasers, ultrasound devices, fillers, and other injectable products. My philosophy of practicing medicine is to treat the patient as an individual, to assess their needs, whether they're medical, surgical, cosmetic, or a combination, and approach the patient individually and try to help them understand, have realistic expectations of what we can do for them. When you first arrive at the Laser Skin Care Center, we will ask for some information, always allow some time for getting the paperwork out of the way. You'll be escorted to the room by one of our nurses or medical assistants. We'll then take information and try to get initial idea of your concerns, and then the doctor will come in and discuss with you your concerns, whether it's medical. We generally recommend a full body skin exam and skin cancer screening. If there are cosmetic concerns, the doctor will discuss all the options regarding your concerns, in addition to speaking with our cosmetic consultant. One of the major focuses of my practice is in skin cancer removal. I was trained in Mohs micrographic surgery and reconstructive techniques through a fellowship at UCLA. This is the gold standard for removing skin cancers that are either large or recurrent or in cosmetically sensitive areas. It allows us to remove the skin cancer with a very narrow margin with high levels of accuracy, as we utilize our laboratory to immediately test the tissue that's removed, check for residuals, make sure the patient is clear, and proceed to remove additional tissue if necessary. When the patient is done, they have the highest level of accuracy and cure rate for removing the skin cancers, and the smallest potential wound and the smallest potential scar. For Mohs micrographic surgery patients, we ask patients to be prepared for anywhere from 2 to 4 hours in the office. They come in having eaten and with something to occupy their time. There is definitely some waiting time while the tissue specimens are processed in the laboratory. All the procedures are done under local anesthesia. In general, the patients are able to drive themselves to and from the office.